Are cancers treatable? That's a question that readily calls to mind when the diagnosis is relayed back to the patient. And this is what we at Medic Echo will try to answer. Cancer is one of the world leading causes of death. The World Health Organization reports that in 2021, the world crossed a sobering threshold where about 20 million people were diagnosed of cancer. And of these 20 million, half of them died from the condition.
What is cancer? Cancer is an umbrella term that describes the disease conditions that occur when cellular changes causes an uncontrolled growth and cell division within the body. There are different types of cancers affecting different parts of the body.
While certain types of cancer cause rapid cellular growth, some others cause cells to grow and divide at a slower rate. Some forms of cancer cause visible growths called tumors, while some others, such as leukemias, which are cancers of the blood, do not.
The most common cancers are that of the breasts, cancer of the lungs, colorectal cancer, and prostate cancer.
Others are melanoma. This is a very serious type of skin cancer, cervical cancer, liver cancer, kidney cancer, bladder cancer, non-Hodgkin lymphoma, and many more.
Cancers arises from the transformation of normal cells into tumor cells in a multi-stage process which generally progresses from a precancerous lesions into a malignant tumor. These changes are as a result of interactions between the person's genetic factor and three other categories of external factors.
Agents include physical carcinogens, such as ultraviolet and ionizing radiations, chemical carcinogens, such as asbestos, components of tobacco smoke, arsenic, which is a drinking water contaminant, and alcohol aflatoxins, which is a food contaminant. Biological carcinogens, such as infections with certain viruses, bacteria, and parasites. Cancer-causing infections such as human papillomavirus, HPV, and hepatitis are responsible for 30% of cancer cases in low and lower middle income countries.
About one third of deaths from cancers are due to tobacco use, high body mass index, alcohol consumption, low fruits and vegetable intakes, and lack of physical exercise.
The question of whether cancers are treatable can be answered thus. Yes, all cancers are treatable. Many of them are preventable and curable. However, what determines the outcome of any form of cancer is early presentation, diagnosis, and social economic factors. The key to treatment or successful treatment is dependent on time of presentation. When detected early, many of the complications that may arise from the condition can be prevented, and then the person can live a normal life. The mortality from cancer can be reduced when detected and treated early. There are two components to early detection of cancer, which are screening and early diagnosis. When detected early, cancers are more likely to respond to treatment and can result in greater probability of survival and also less morbidity. It can also lead to less expensive treatment.
Screening. Screening tends to identify individuals with findings suggestive of a specific cancer or pre-cancer before they develop symptoms. When abnormalities are identified during screening, further tests to establish a definitive diagnosis should be done.
Another important factor is the socio-economic status. There is a clear distinction between the outcome of cancers in low-income countries and high-income countries, with comprehensive treatment reportedly available in more than 90% of high-income countries and less than 15% of low-income countries. That means Someone with a disease in a low income country is more likely to die than someone with same disease in a high income country.
The care of cancer involves a multidisciplinary action that has been identified as the key enabler in the provision of high quality treatment and care for cancer patients. This is instituted once the diagnosis is
A
made.
correct cancer diagnosis is essential for appropriate and effective treatment. This is because every forms or types of cancer requires a specific treatment regimen. Treatment usually might include surgery, radiotherapy, and or systemic therapy, such as chemotherapies, um, hormonal therapies, or targeted biological therapies.
The goal of treatment. The primary goal is to cure cancer or to considerably prolong life. Improving the patient's quality of life is also an important goal. Now, this can be achieved by support for the patient's physical, psychosocial, and spiritual well being, and palliative care in terminal stages of cancer.
Preventing cancer. Cancer risk can be reduced by not using tobacco, maintaining a healthy body weight, and eating balanced diets, including fruits and vegetables.
Other preventive measures include engaging in physical activities on a regular basis, avoiding or reducing alcohol intake, and getting vaccinated against human papilloma virus and hepatitis B.
Avoiding ultraviolet radiation exposure, which is due to exposure to the sun and other tanning devices, ensuring safe and appropriate use of radiation in healthcare.
Others include minimizing occupational exposure to ionizing radiation and also reducing outdoor and indoor air pollution.
Yes, cancers are treatable, but early presentation and diagnosis are key to treatment success.
Yes, cancers are treatable, but early presentation and diagnosis are keys to treatment success.
Yes, cancers are treatable, but early presentation and diagnosis are key to treatment success.
Yes, cancers are treatable, but early presentation and diagnosis are keys to successful treatments.
Yes, cancers are treatable, but early presentation and diagnosis are fundamental to achieving treatment success.
Yes, cancers are treatable, but early presentation and diagnosis are key to treatment success.